Tomo&Dana here. So in this video, I want to share one of the most important differences between living in America versus living in Japan, and that is healthcare. So there are some pretty big differences, and I want to explain how the American system works. So let's talk about it.
チャンネル登録よろしくね。
So of course in Japan, health insurance is nationalized. So everyone can get health insurance from the government. So in America, it's not nationalized. There are many different private companies that offer health insurance. But where the system is very strange is that health insurance is offered through your employer. So generally, the consumer doesn't directly pick their health insurance. Their employer chooses. They might choose some different plans and offer them to the employee to choose which plan they want. But it's not like a free marketplace of health insurance companies and the consumer directly chooses, okay, I want this company and I want this plan. It is possible to get health insurance not through a company, like say if you're unemployed or something, but it's generally expensive. And as you might guess, this system is really messed up because if you lose your job, you lose your health insurance. And you also don't have the freedom to choose a plan that works best for you. It's very strange, isn't it? So in America, you can stay on your parents' insurance plan, like they have like a family plan, until you're 26. But then once you turn, I think 27, you have to go on your own plan, and it's really expensive. So it can be really difficult for a young adult who's not making a lot of money to be able to afford their health insurance. So before I moved to Japan, I think that my health insurance was about $200 a month, and my company paid for part of it. So I researched, the numbers on this, and apparently the average price for an individual plan, which is like the consumer buying directly from the company, is $456 a month, which is ridiculous in my opinion. Or it's about $100 if this person has a plan through their employer, meaning that the employer is paying the rest of the plan. So when I say plan, it might sound a little bit confusing, but basically there are many different private insurance companies and they all offer different plans. So like there's cheap plans, somewhere in the middle, there's premium plans. And so generally speaking, if you get a cheaper plan, it's not going to cover as much of your actual healthcare costs, which is also, sucks, because you could be paying, $200 a month and still they won't pay for all of your healthcare costs. No. And I'll get into that in a moment. So health insurance companies in America have what's called a network, okay? So they choose which hospitals, which doctors are covered under their plans. So if you go to an out-of-network hospital or doctor, they don't cover it. So you have to make sure that the clinic you want to go to or the hospital you want to go to is covered within your health insurance plan. So yeah, what happens if you say get in an accident and you're taken to a hospital that's outside of your plan? Yeah, you pay. It's really, really weird. Like the system, it doesn't make any freaking sense. It's stupid. So one thing that really surprised me when I moved to Japan was how easy it is to get medical care. What I mean is, if I'm sick, I can easily just Google a clinic near me and just go. Most places accept walk-ins, and you're seen by the doctor, you're given a prescription if you need it. It's easy. And then, you pay a fairly low price, in my opinion, as an American. It also gives you peace of mind because if you're sick, you know that there's some option for you, that you can go be seen quickly. And yeah, that's not the case in America. So in America, you usually need an appointment. So if you're sick, if it's a checkup, anything, you need an appointment. So what people usually do in America is they have a primary care doctor. And then if they need to see a specialist or a different hospital or something, the doctor will refer them to a different place. Which sounds good, I guess. But the problem is it's difficult to find a new primary care doctor. You have to find a doctor that's accepting new patients, and then they might not have any appointments available for a while. So actually I had this problem. I'm originally from Maine and then I moved to Boston. So when I was in Boston, I needed to find a new doctor because I needed to have my prescriptions refilled. Well, I called so many different places asking, is this doctor accepting new patients? And most of the time it was no, sometimes it was yes, but they didn't have any appointments for like 4 months. Like, I needed my medication before then, so that was out of the question. So in the end, I actually ended up going to a doctor in Maine, like 3-hour drive away. Like, that's kind of ridiculous. I had to literally drive 3 hours to go to the doctor just to get a prescription that I had already had. Like, I didn't need like a consultation or anything. Like, that's messed up. So I'm really glad I don't have to deal with that in Japan. So probably you're wondering, what happens if you're suddenly sick in America? Well, you can go to a walk-in clinic. Generally though, you're going to be waiting for a long time at the clinic waiting to be seen. So yeah, it sucks. It's really, really not easy or fast to see a doctor. That's what I wanted to share today, and I'll see you in the next video. Bye.
チャンネル登録よろしくね。